Hello, IMEI students. First of all, welcome to medical school. My name's Gabe Conley. I was originally slated to talk to you guys at 11:40 a.m. today, but regretfully, I completely whiffed on that because I was in an interventional radiology procedure that I was able to participate in. And I was so gung-ho to do that because I just recently came back to med school from an MBA year that but before I knew it, it was already noon and I had missed out on my opportunity to talk to you guys, which I really regret. I'm sorry about that. So I'm making this video to kind of highlight why the HDSMP, the Healthcare Delivery Science Management and Policy Distinction Track, is a really good option for some of you, particularly those of you who think you might want to be decision makers beyond helping out your patients in the future, okay? Decision makers in policy, decision makers at your organizations, whether you're working at hospitals or working in physician practices or other delivery care centers, because something we haven't talked about, because I just started recording, is that healthcare is changing quickly, okay? Big players like Amazon, Walmart, kind of non-traditional players are emerging into the healthcare industry, which is about 20% of our nation's GDP. It's a huge industry considering we have the largest economy in the world. This is a big industry. And while physicians are experts at delivering care to patients individually, both in clinical exam rooms and in operating rooms, what can happen and what does happen is physicians are sometimes siloed into sort of widgets. Operational widgets in some settings. This isn't the case everywhere by any means, but in some settings, physicians become sort of production units for hospitals that they work for. And this isn't a good setup considering that physicians are experts in taking care of patients. So that kind of highlights a need for physicians to learn about the healthcare industry at large, beyond what medical school, the traditional medical school curriculum teaches. There was a time when most physicians worked in private practice and they called their own shots in most capacities. They hired their own staff, they kept their own medical records, they were paper charts, they leased or bought some diagnostic equipment, or they had partnerships with like radiology groups or pathologists. Okay, but tides have turned, things have changed, and the physicians who understand the healthcare industry at large will be well positioned to become decision makers outside of the clinical exam room and outside of the operating room. But in addition to those two things, right? So med school, Carver College of Medicine, the standard curriculum will teach you to become an expert at taking care of patients. I have no question about that. That's for sure. But there's just more to healthcare, this huge industry, than taking care of individual patients. And that's the whole crux of this distinction track, the HDSMP. Basically, 5 or 6 years ago, a handful of students went to Dr. Alan Reed. He's a transplant surgeon and the director of the transplant department at the University of Iowa. And they had some data that showed that med students want to learn more about the healthcare industry because of how the industry is changing over time. And Dr. Reed is an MBA himself. He basically, in some sense, built the transplant department here very successfully. It's a booming department. He's got a mind for administration and business. And he is our faculty leader of the HDSMP track. But what makes this distinction track unique is that it's student-led. So all the other distinction tracks are great. Humanities, global health, research, service, etc. But they are not student-led, right? They're faculty-led, which is great. What makes this distinction track great is that students have a significant say in sort of what we learn about. And so there's a student leadership team, which anyone in our distinction track can apply for. It has usually about 4 to 6 people on it. depending on the nature of the students that are involved with the leadership team. Like, for example, I'm an MBA student, so I stayed for an extra year, and we have a couple of PhD, like MSCP students on the leadership team too. So they kind of obviously stay for longer than the 4 years. But yeah, typically there's probably 4 to 6 or 7 student leaders, and the student leaders meet with Dr. Reed and Hugh Hansen, our administrative faculty leader, about twice per quarter, and kind of determine our programming for seminars. So the HDSMP is primarily a seminar distinction track. So our members are required to attend 9 seminars that cover various topics throughout their time as members, and as a requirement to graduate with distinction. So that's one kind of base requirement. You know about distinction tracks. This was kind of the talk that I was going to give you guys, but since I'm doing it like 8 hours later, I'm going to kind of just talk and have this presentation on in the background. But so the whole idea of the distinction track is to expose our students to healthcare well beyond taking care of patients and treating them and diagnosing them. So basically, I just finished my MBA, and I would say the HDSMP track, considering I'm someone who's done both, the HDSMP is a little bit of a mini MBA, or like a mini MHA, Master's in Healthcare Administration, for medical students. You'll be exposed to topics that are critically important, such as e-health, which is obviously emerging. COVID has accelerated tons of trends, including telehealth, e-health, digital health, legal issues in medicine, how to lead highly effective teams. So physicians are leaders by their very nature, but we're not all physicians are actually sort of trained on effective leadership techniques. And so while that might not be a complete necessity for treating patients and diagnosing them, it might be completely necessary for leading a team around you that might have advanced practice providers like nurse practitioners, PAs, nursing staff, medical assistants, pharmacists. There is a science to leadership, and we had a seminar just in the past year led by expert faculty from the Tibby College of Business that taught evidence-based leadership techniques. So all physicians are leaders, but that doesn't mean we're all good leaders or effective leaders. So that was a seminar. All these seminars take place on Saturdays. That was a seminar that just covered evidence-based leadership techniques with a ton of applied group work and sort of case-based learning, which is much like MBA school. So Dr. Reed has an MBA, and he's kind of adopted the MBA style of teaching, which is a lot of case-based learning. We do a lot of case-based learning in our distinction track. So other things include personal finance, operations management, advocacy, which was great, policy, negotiations, accounting, entrepreneurship. There's a slew of other programs that we've done in the last 3 years, and what makes this so great is the fact that our programming comes from what our students want to learn about, outside of some of the core sort of seminars that we make sure all of our students are exposed to during their time. So basically, students will be in our distinction track for about 3 years, and in that time they'll have 5 or 6 core seminars that Dr. Reed and Hugh Hansen think are critically important for students from our distinction track to understand. But then we have 3 sort of elective seminars that are based on emerging trends like e-health and leading highly effective teams. So we're adaptable. Our programming comes from our membership, and most specifically, our student leadership team kind of makes the final call on what our seminars are going to entail based off what our members tell them and what they're the most interested in. So attending seminars is one base requirement, but then there's also a capstone project. Capstone project is similar to some other master's degree requirements. It's basically a project that's student-led but mentor-advised. So all of our members have a faculty mentor from the University of Iowa Hospitals and Clinics who helps them identify a topic of interest, like a research topic or a quality improvement topic, and kind of guides them on developing a protocol or a project to lead effective change throughout medical school. These projects usually take like a year to complete, kind of at the student's own sort of pace, and these are really well received. So basically, to graduate with distinction, in the sort of spring of your M4 year, you summarize your capstone project. A lot of our capstone projects have also led to publications and presentations at national conferences, in addition to the capstone project that you'll give to your fellow members and some faculty as well. And it's the same sort of requirements that standard research presentations have. So it's about a 10-minute presentation with time for questions at the end. And there's so much learning that happens at these capstone projects because students have really applied some things that they learned from related blocks, related seminars into real practice, led by mentors that are doing that, that are interested in doing that type of work in a real healthcare setting like UIHC, which is the largest hospital in Iowa and the only tertiary level 1 trauma center in Iowa. So capstone project is kind of the cherry on top of graduating with distinction, and students, it's been well received in my time here. So this is my 5th year in medical school. So what's a typical HDSMP seminar like? This is an example of our case-based sort of learning environment. After some didactic lectures about human resources and strategic talent management, we group up with fellow members and we basically go through a case. And then we kind of have like maybe 45 minutes to kind of work through that case. And then we meet up towards the end of the seminar and share ideas about how we would have approached that given case-based challenge. And that's where a lot of learning happens. So you start with maybe an hour and a half or so of lecture, followed by some sort of question Q&A. And then in the final hour, it's usually a case-based learning module to kind of tie it all together. This is the case for all of our HDSMP seminars. So there is a P now at the end of the Healthcare Delivery Science and Management track. That's what it used to be called. Now it's the Healthcare Delivery Science Management and Policy track. And this is new. Basically, it has culminated in a 4-week elective experience that's available only to HDSMP students, wherein the students will have free housing in Des Moines and be able to work with state legislators and state lobbyists, or not state lobbyists per se, but lobbyists or state legislators who are advocating for policies that are related to healthcare. And these can be directly related to healthcare or sort of ancillarily related to healthcare. It's really whatever the students are interested in. And the whole point of this, it kind of gets at the idea that the HDSMP track is member directed. Students on the leadership team, is actually primarily me and a couple of other students, realize that advocacy is critically important in medicine, both for our profession, but even more importantly for our patients. If we want to make sure that patients are set up best to receive high quality care at reasonable prices that make sense, physicians, AKA the experts in actually delivering care to people, need to be involved in the legislative system. It would be best if more physicians served in public office for this, but that probably starts with increased involvement in advocacy activities during medical school. And so that's what the policy aspect of the HDSMP program kind of brings home. So this is a 4-week elective experience wherein students can work with legislators to literally pass state laws out of Des Moines, kind of learn the process for how does an idea become a proposal, which becomes a resolution, get proposed in a committee, a state committee, battle through that process, talk to stakeholders, try to secure votes. If that passes, perhaps go to the floor of the House of Delegates. If that, get voted on, if that passes, go to the other chamber, into the Senate, and perhaps become a law. This is a 4-week elective where you live in Des Moines in the spring of your M4 year, only available to HDSMP students, where you get to literally see what the advocacy process looks like. And I'm someone who's been very involved with advocacy in my life. And I know that these are the types of experiences that last a long time and really kind of shape a worldview. And so I was really excited that we were able to do this. It's been very well received. We'll be going into our 3rd year of offering this elective, and it's been very well received. And we're always trying to make it better for our students as well. So it's very exciting. And then one final requirement we have is that all of our members must take one of these 3 electives during their M4 year. It's either leadership for future healthcare professionals, financial management for the rising interns. This is a personal finance course, very well received, taught by an excellent physician from the Iowa City area. And then, you could take the patient safety and quality improvement course, which really gets at the heart of the HDSMP track as well, right? Improving patient safety and quality. That's how we improve healthcare, hopefully at a lower cost, because costs are also rising like crazy. So like I said, medical school is life-changing in a lot of ways, whether that's through research, leadership, service, global health, HDSMP activities, you name it. The next 4 years will change your life. This distinction track is for some of you, especially if you want to be a decision maker. A decision maker for your future employer or partnership, depending on wherever you want to work. About 50% of physicians work for an employer like a hospital, and about 50% work with private physician partnerships. It's about half and half, but both of these entities need like medical officers, people that understand how to take care of patients, but also understand sort of the finance and accounting aspect of running an organization. In addition to operations management, strategic talent management, negotiations, understanding trends in healthcare, okay, all these things. Some physicians are going to become decision makers. If you think that's something you want to do, then this distinction track is probably for you. If you have any questions, you can reach me at Gabriel-Conley@uiowa.edu. I'd be happy to talk to any of you. But you also have plenty of time to decide too. So you'll have an official sort of M1 introduction to our distinction track later in your M1 year. So this is just a primer for IMEI students. Again, I'm sorry, this was kind of long-winded. I'm sorry I didn't make it to the talk today. Really sorry about that. You guys deserve better. The MPI was cool, but I should have gotten out of there sooner. So with that, that's all I have for you guys. I hope you have a great IMEI experience, okay?